They support in Israel child abuse and neglect and the strengthening of Jerusalem, basically. When they started working on child abuse and neglect in Israel, they realized that one of the ways they could contribute a lot, also based on the size of Israel, is by enhancing the knowledge and the training of professionals from all fields, and they decided to establish this institute and support it on a long term.
And then I think we need to be thinking carefully about what it takes to test and replicate those preventive interventions that show promise. And again, I think we need to be thinking in a scientifically and clinically rigorous way about the replication process. All of this, of course, is really daunting, but I think there's reason for hope.
This is a good opportunity for us here when we have such good people from different disciplines, from social work, from medicine, from social policy, for analysts of social policy. And for that, I think that we have to take now all these information and to process it, to learn more about it, and to actually to introduce it into our programs, and it's only the beginning.
We're looking at child maltreatment, something extremely negative, and turning it into something positive regarding prevention, regarding training and education, regarding better services, and regarding better research. This really is moving toward a science, and there's a science of evidence-based practices. These are the models that you should use to work on early intervention and work on treatment for child abuse. These are the models you should start working on as far as preventing child abuse. And that's new. We didn't have that before.
I'm a pediatrician. There are a few of us from the medical community here, but we have expertise from many different fields, and I don't often have the opportunity to sit down with critical thinkers and policymakers and researchers to really listen and learn about how we improve our systems in the future, and I think it gives us an opportunity to think outside the box a little bit.
I think we succeeded in assembling one of the biggest names or the most known experts, experienced experts in doing research and in the field of child maltreatment. And together with a group of local experts, we sat yesterday for a full day and basically discussed what's going on in the United States and Israel, ideas for collaboration, and some of them are already starting to shape. So we are talking about a mutual course in the social work department in Israel, and in OU Tulsa we are talking maybe about doing some support and mentoring for young researchers together. We are talking about some comparative research and some projects where institutions from the United States and Israel will go together to deliver the knowledge and experience in third side countries, developing countries around the world. And I think that what we have done yesterday was the beginning of an ongoing relationship, certainly with OU Tulsa, and definitely with the group of experts that came here.
First of all, if we think about training clearly needs to be far more intensive, far more structured, and far more tailored to the professionals in the field as we are generating and implementing evidence-based practices in the field. The training processes are not divorced from the actual generation of new knowledge, but in fact training is part and parcel of the generation of new knowledge.
In evidence-based practice, the ideology of comprehensiveness is dying. We need a program for every problem. And the emerging evidence suggests that what we need is focus, that we need to identify through assessment what really are the key leverage points for meaningful change in a particular case, and then focus on those with depth and intensity as opposed to trying to do a little bit about everything and ending up feeling hopeless and like we can do nothing about anything.
I think today the most interesting for me is that many of the people that are here are people that I've read their work about, I know of them, but I've never sat down in a room and discussed some of these issues. And I think on a day-to-day basis, although I see patients, a lot of what I do is research, and I think some of the research we do is very patient care based, and I think it's really important when I hear all of these more systemic issues and the public policy implications of what I do kind of expands my thought about where our research fits into the broader idea of where child abuse research is going, where it's been, but really where it's going and what the future needs to include to make this research successful.
in Israel at least, that was among their first steps in philanthropy. They helped to create the first emergency center for children in Israel called Sukkot Shalom. They helped to create the first child protection center called Beit Lin. And it's something that really stems, I think, from a very personal commitment on behalf of Lynn Schusterman, who, as a young bride, volunteered with the National Council for Jewish Women here in Oklahoma, helping children who were the victims of abuse.
It takes at least a decade or more, probably even more, to see the results of the operations of an institute like the Haruv Institute, or the results of training professionals across the field. And therefore, without such a support, I don't think it would have been possible. And within a couple of years, we hope to start and see the results.
Where we go from here is, I hope that this is, as I mentioned earlier today, it's really the end of the beginning of recognizing that this vision and that we have for the Haruv Institute and for our dream of eradicating abuse and neglect everywhere in the world, we now have the foundation in place and that we can build upon. Where, of course, it's going to be very difficult to eradicate abuse and neglect everywhere, but that's the reach goal that we want, and that we've brought together some people who can actually help us make very significant strides in that direction.